breastfeeding the late preterm or near-term infant. How is breastfeeding affected by having a baby who is born somewhere between 35 weeks of age and just before 38 and 0 days gestation? So the definition of premature, late preterm, near term, early term, there's a lot of confusion about exactly what is the definition of full term. OBGYNs may have a slightly different definition than neonatologists or pediatricians, but it does matter for their neurodevelopment and their ability to be excellent breastfeeders. So the reason that we're talking about late preterm and near-term infants as a separate group of breastfeeders is that they do need special care for follow-up, and there are protocols that can help you get off to the right start. There are many women who know that they will be induced early and can prepare to be able to breastfeed a late preterm infant. Other mothers are caught off guard that they have a premature baby and are not able to be as ready as they could be. And maybe you have your infant at home now and you're trying to transition a baby to the breast. So the babies that are born before full term have issues that involve their tone, their strength, their size, the size of their mouth, the width of their cheeks, their ability to make a vacuum, the ability to pull milk out of the breast. So when you have a baby that's in that 4-5 pound range, even sometimes in the low 6 pounds, they look just like a gorgeous, beautiful full-term baby, just a smaller version of it. But they are called the great masqueraders for a reason, because when they're on the breast and feeding, sometimes it looks like they are taking the milk out. It looks like they are drinking, but in reality, they are not strong enough to pull out a full feed from the breast. Someone that I highly respect and who has published many protocols to protect breastfeeding goals of mothers of late preterm infants is Dr. Jane Morton. She's a pediatrician. She was at Stanford University, is now in private practice. She has many protocols and publications about the safe way to feed a late preterm infant. We'll show you links that you can click on to be ready for how to be at home with a baby that is born late preterm. The general concept is that you need to dial in your order for milk volume for a larger baby, even though you have a smaller baby that was born. So you have to trick your body into making enough for a full-term baby, for a larger baby, so that when your late preterm infant is at that size, your body is making enough for a larger baby. So the way that you do this dialing in the order is by something called triple feeds. So we have a whole other video that goes into the components of triple feeding, but the concept is that a baby will latch to the breast who is late preterm or is just not a great feeder or is small for gestational age. So they will latch and do their feeding, and then a mother will pump afterwards to either empty the breast fully or just give extra stimulation to the breast. And then the third step of the triple feeding is that the baby will be fed some of that volume as a supplement. So if you try to treat a 35-week infant the same as you would treat a 39-week infant, they do not have the same feeding ability. And a smaller baby, a 35-week baby, may be slow to gain weight, have prolonged jaundice, be readmitted to the hospital, and in general the mothers will develop low milk supply because they've relied on a small baby by his or herself to maintain a full supply. So the concept of dialing in the order means you trick your body into thinking that you have an 8-pound baby and not a 5-pound baby. It's very challenging to feed a late preterm infant. Very often they've had a few days or longer stay in the neonatal intensive care unit, and you almost feel like the hospital owns the baby or that you have a complicated baby. So we try at our office visits to see late preterm babies once a week for weight checks, and we can transition off triple feeds. We can get you breastfeeding support with one of our lactation consultants. Very often these babies need a nipple shield, and nipple shields carry risk. they certainly carry benefit, but they do carry risk. And so our lactation consultants can set up appointments. You can ask your pediatrician for an appointment with one of the lactation consultants, and we will work through your insurance to find a way to get the baby and you seen in the Agave office. So know for sure that breastfeeding a late preterm infant does come with early challenges, but there's no reason that you cannot meet your full breastfeeding goals, even if you have a late preterm baby, if you get the right advice early on.